Hello everyone, and thank you for joining us today. My name is Sophie Reyes, and I'm the Marketing Director at A&D Medical. I'm pleased to welcome you today for this webinar presented with our partner A&D Medical. We're excited to have Dean with us today. He will be leading the presentation and sharing his expertise. If you have any questions during the webinar, feel free to write them in the chat box. And after the session, you can contact your Best Buy Medical Supplies territory managers for more information. So thanks again for being here and have a good webinar. Dean, you can start.
Oh, thank you. Hello and welcome everyone. I'm Dean Karim, the National Sales Director for A&D Medical. I just want to thank you today for joining us at this special session focusing on empowering healthcare professionals, especially those on the front line of patient care. We're really talking about pharmacists, nurses, and clinical team just like you. Just to give you a little background about myself, I've been with A&D Medical Auto Control for 35 years. And I've seen lots of changes in industry over these past 35 years. I can recall when I started, a physician didn't recommend home blood pressure monitoring. Now today, it's actually the standard and is encouraged, and patients are encouraged to monitor their blood pressure monitor. So a couple of things we want to cover today is why A&D Medical, how to measure your blood pressure for accurate reading. We'll be introducing 3 new blood pressure with enhanced features. We have a 4th blood pressure monitor will be introduced later today or later this year that has features like precision check, which really takes blood pressure monitoring to the next level. And we'll talk about our HeartTrack app. So for nearly 50 years, our company has been a trusted partner in healthcare, and we have been leading the way in clinically validated blood pressure monitor. We are recognized as Canada's #1 patient recommended brand. We are proud to support the vital role you play in guiding patients towards better healthcare outcome, right from your pharmacy counter or your clinic office. Our commitment is simple, and that is to provide an accuracy you need, the reliability you expect, and the support your patient deserve. And with industry-leading 5-year warranty, we have bilingual customer service, easy to use, validated blood pressure monitor. A&D helps make your recommendation with confidence and patient care. Whether you're counseling patient on hypertension, managing chronic patient care, or recommending home monitoring solution, A&D Medical is here to support you and your patient every step of the way. So let's take a moment to talk about something that's absolutely critical when recommending home blood pressure monitor, and that is clinical grade accuracy. At A&D Monitor, our blood pressure monitor, be it for home use or in a professional setting, is all clinically validated to ensure accuracy and reliability. And this isn't just a checkbox for us. It is a core part of our commitment to healthcare providers like you and to the patient you support every day. We've been working with Hypertension Canada since 2017, and we have helped initiated the validation program. This collaboration was a natural fit for us as we have been supporting Canadian Hypertension Initiative and working with Medical Associate for over 10 years. So you may ask, why is this important? Well, Hypertension Canada is highly respected for the work in detection, prevention, and control of high blood pressure. Their validation process provides guidelines not only for professional, but also for consumer. And this really helps them make informed decisions about their health and how to choose a device that's going to give them accurate, consistent reading. So you'll notice the validation logo right on our packaging. And this is by design. It makes it easier for consumer to recognize a product that meets national standard. So when you recommend an A&E monitor, your patient can quickly identify the validation and know this is a trusted device, even at the point of purchase. Ultimately, this partnership strengthens the commitment between you, your patient, and better healthcare outcome, all backed by shared commitment to accuracy and clinical excellence. So as healthcare professional, it's essential to remind patients best practice for accurate home blood pressure monitoring. I just want to take a couple of minutes to emphasize some of the key things that you should really talk into about your patient for accurate, consistent reading. And one of the things that is recommended by Hypertension Canada is patients should rest for about 5 minutes before taking a measurement. They should also avoid taking caffeine. That's like having a cup of coffee or tea. They should avoid smoking or even exercising 30 minutes before reading. Simply by emptying your bladder also helps with accurate reading. And this is something that a lot of people tend to overlook. Then you look at correct body positioning. So what's the correct position and what you should be doing? So really what's recommended is to sit with your back supported, both feet flat on the floor. Your arm should be supported at heart level and cuff on your bare arm. And you should also avoid talking or moving. So really what you want the patient to do is stay still during the reading. Well, now, it's also recommended to take multiple readings, at least 2 to 3 readings, 1 minute apart, and take the average of this. So this is really the recommendation from hypertension guidelines. And of course, use a logbook or a compatible tracking device system to keep track of all your readings. So before we dive into our new enhanced blood pressure monitor, we're also proud to share the redesign of our packaging. And our packaging have really been designed with consumer experience at the heart of everything. So when you look at our new packaging, the features are clear, bold, with clear imagery and straightforward features, names, so it makes it easier than ever for customers to understand what it is they're getting at a glance. Our updated design reflects unified brand identity, reinforcing A&D Medical commitment to accuracy, ease of use, and a trusted device. Whether on the pharmacy shelf or in a clinical setting, the new look communicates exactly what A&D stands for. And that's simple: precision you can trust and care you deserve. So let's look at our new lineup of blood pressure monitor. Our new lineup of blood pressure monitor is really designed to meet a wide range of patient needs, all while delivering clinically grade accuracy you can trust. So let's look at our first monitor here, which is the UA660 One Touch. This model is really a product designed for its simplicity. It's a one-button operation, making it incredible, easy, user-friendly, especially for the first-time user or elderly user. But don't let the simplicity fool you. The 660 is designed to deliver clinical-grade accuracy, offering results as precise as those taken in a professional setting. The unit comes equipped with a wide-range cuff. So it fits an arm from 8.6 to 16.5, and you do have the option of replacement cuff to cover almost any arm size. So it includes, so patient could buy a cuff, a small cuff, a large cuff, and use it with the same device. For users who want to track their healthcare over time, it features 60 readings. So there's 60 readings that's in the memory. So this really eliminates the need for handwritten notes or taking your reading and logging it. And it even displays the averages of your last 3 readings. So it gives more consistent picture of your blood pressure trend over time. What's also included as standard feature on all our devices is advanced inflation and deflation technology. So what this does, it allows the reading not only to be faster, but more comfortable for the patient. What you'd also find standard on all our blood pressure monitor is pressure rating indicator, which compares the user's reading to international accepted guidance. We also have irregular heartbeat and AFib detection. And I just want to talk a little bit about AFib detection, because when you look at AFib detection, this is something that is standard with all our blood pressure monitor. When you compare us to other companies, AFib is something that other companies charge a premium for. So only on the premium model from competitors, you will find AFib detection. Whereas with us, AFib is a standard feature and is included in all our blood pressure monitor. So the 650 has a lot of standard features that's built into it. It also comes with batteries, a carrying bag, and all this is included in the box. So you're good to go right out of the box. It comes by a 5-year extended warranty, offering real peace of mind. So overall, the One Touch UA660 is an ideal solution for patients seeking a product that's accurate, comfortable, easy to use. Now let's look at the next model in our new enhanced series, the UA770 multi-user, which is a versatile Bluetooth device. It also has built-in clinically grade accuracy and is designed to meet the needs of multiple household users. This device supports up to 4 users, so 4 people could use it and store up to 60 measurements separately. So what this does, it reduces the need to purchase multiple monitors. So it's ideal for a family setting. And each user can automatically store 6 measurements on the device. This device is also Bluetooth connected, and all readings can be synced to our A&D HeartTrack app, where users can view trends, share reports, and manage their long-term health. The 770 is equipped with advanced inflation and deflation technology. It has cuff fit detection. So what cuff fit detection does, it really ensures correct placement, and this minimizes user error. So this is something that could significantly affect the reading. It also includes motion detection, which alert the users when when motion may have interfered with the movement, helping reduce false reading and reinforcing best practice. As with all our other monitor, this model also have advanced inflation deflation technology, making the process faster, more comfortable, especially for frequent users. It also displays the average of your last 3 readings, offering clear and more reliable picture of your blood pressure trend. You also have irregular heartbeat and AFib detection, a valuable feature that flags potential sign of arterial fibrillation or the rhythm irregularity during routine check. And like all A&D medical device, the 770 is backed by extended 5-year warranty, ensuring long-term reliability and confidence. So if you're looking for a Bluetooth multi-user monitor, This combines smart technology with medical grade performance. The 770 is an excellent choice for your patient. Rounding out our new enhanced series, we have our UA1040, which is a voice guided blood pressure monitor. And this monitor is also built with clinical grade accuracy, along with inclusive, user-friendly features to support a wide range of patients. What really sets this monitor apart is its multilingual voice guided. It provides clear, audible instructions in English, French, and Spanish. So it makes it ideal for users with visually impaired, literacy challenge, or language preferences. It also includes HeartTrack technology, which automatically takes 3 consecutive measurements and displays the averages. So what this does, it helps to reduce variability of a single reading, and this is really aligned with the best practice as recommended in clinical guidelines. For added accuracy, the device is built with cuff fit detection and motion detection. So what this does, it minimizes the risk of user error due to improper positioning during the reading. The 1040 stores up to 90 measurement, and it seamlessly connects with our A&D HeartTrack app. So this enables unlimited digital tracking, long-term trend, and the ability to share data with healthcare providers, or you could even share the data with other family members. As with our other models, users benefit from fast, comfortable reading thanks to advanced inflation and deflation technology. And the monitor comes with batteries and a carrying case, so it's good to go right out of the box. And like all our other monitors, standard features like irregular heartbeat, AFib detection, which give patient and professional an extra layer of insight. And of course, it's backed by our 5-year extended warranty. This really enforces our commitment to long-term reliability and patient care. So when you look at the UA1040 Voice Guided, this is a perfect choice for inclusive monitoring. It combines smart features such as voice accessibility, clinical grade accuracy, and this meets a need of a diverse patient population. These 3 models really gives you the flexibility to recommend a tailored solution to each patient. So whether you're looking for simplicity, a product with advanced features, or inclusive design, you've got a choice now. So all our monitors, all these comes by a vigorous validation and commitment to quality. Now, I just want to take a couple minutes to introduce our new product that we'll be launching later this year. So we really want to introduce here is the 810 Precision Check. And the Precision Check, it really has enhanced series with it's really the next generation that is really designed with clinical grade accuracy, with precision focus on technology and enhanced usability, and makes it ideal for both professional setting and home use. This product combines advanced cuff fit detection, motion detection, and cuff leak detection. So this eliminates common source of errors, and it really gives you a reliability and gives you more insight. So one of the things that's really important here that is we have built in here is cuff leak detection. So a lot of times we get customers calling us and saying, well, I've had my monitor for 3 years, 5 years, how could I tell if my monitor is still accurate? Is there a calibration process I could do? So with our cuff leak detection, it actually gives the patient the ability to do a calibration check to see if the integrity of the cuff is still good. Because what tends to happen over a period of years, we find the cuff is what disintegrate. So now the customer have the ability to do a calibration check to see if the cuff is working correctly. And this is something that's unique to the Precision Check series. And there's no other monitor on the market that offer this cuff leak detection process. So that's something that really separates this monitor from anything else. We also have the programmable TriCheck feature. And these features follow clinical guidelines by automatically taking 3 consecutive readings, and it displays the averages. So what this does, it helps to minimize the impact of just one measurement. Sometimes you get fluctuation from one measurement to the next measurement. So to provide a more complete picture of cardiovascular health, this unit also displays averages of both your AM and your PM reading. So it helps track the blood pressure variation across different time of the day. It also supports 2 users. So 2 people could use it, each with 90 readings, and of course, unlimited data tracking on the HeartTrack app because it's a Bluetooth device and it integrates with our A&D HeartTrack. And this is really ideal for sharing trends and sharing report with your healthcare team or even with members of your family. Now, what's unique to this model is the ability to customize rest time between measurement. And again, this is another recommendation by Hypertension Canada and part of the guidelines. So what's really recommended when taking multiple readings, the patient should take at least 1 minute rest in between readings. With this device, you have the ability to customize that rest period. So you could program it to take a reading 30 seconds, 1 minute, or 30 seconds, 60 seconds, or 90 seconds in between readings. So now you're really in control of better measurement. Again, unique to this device, it has a backlit screen, a huge backlit screen. So it really gives you clear visibility to your reading. And of course, like all our other blood pressure monitor, it comes with a 5-year warranty. It also has features like irregular heartbeat detection. And what this does, it can alert users to potential presence of AFib. And this again is another layer of protection or early warning signs that reassure patients that they're going to get accurate, consistent reading. So when you look at the A10 Precision Check, it's more than just a blood pressure monitor. It's really a precision health tool that's built to support better outcome, smarter monitoring, so patient can monitor with confidence. So stay tuned, that's coming. And we're looking at launching that monitor within a couple of months. Now, one of the most important feature, and it's included as a basic feature or as a standard feature in all our monitor, is AFib detection. So what really is this AFib detection? This is an advanced feature that allows the device to screen for atrial fibrillation, and it's common but often undiagnosed heart rhythm irregularity and can increase the risk of stroke or other serious condition. So during a regular blood pressure reading, the monitor analyzes heart rhythm. So if it detects a rhythm 15% faster or slower than your average reader over the course of a measurement, the AFib indicator will appear on the screen. So this indicator serves as a valuable early warning sign that alerts the users with it really alerts the users to follow up with the healthcare provider for further evaluation. So by combining this type of rhythm screening with accurate blood pressure monitoring, what we're really doing is empowering both the patient and professional with actionable insight. And this is all from a convenience of a home setting. And it's just one more way A&D Medical is helping to support early detection, better healthcare decision, and improve outcome. So to wrap up today's session, I'd just like to highlight key components to enhance blood pressure monitoring. And this is really our A&D HeartTrack. The A&D HeartTrack app is available both on the Google Play Store and the Apple Store. And this was designed specifically by hypertension experts to support users on their health and wellness journey. The A&D HeartTrack delivers seamless, intuitive experience, helping patients track, store, and manage their blood pressure reading, another important matrix. So in addition to blood pressure, you could also manually input things like your blood glucose reading. Or if you got a Bluetooth scale, you could pair it with the A&D HeartTrack. It also tracks your oxygen saturation level. So it combines a multiple matrix into one app. So this app is really designed for better patient experience. So if you are tracking your blood glucose reading, your blood pressure reading, your weight, if you're an asthma patient or COPD patient, this app is really designed with you in mind. So let's take a minute to see how the A&D HeartTrack work and how simple it is. So really what you do once you download the app, you start by creating an account right on the app. And it takes just a minute to create a user profile. And this will really ensure your data is stored and synced to you. Once you have done that, what you want to do is log into the app. You go to the dashboard and select Add a Bluetooth monitor. What happens next is a list of compatible devices appear on your screen. You simply choose the model. And if your model support multiple users, like our multi-user or the A10 series, you just select the appropriate user profile. Next, just follow the on-screen instruction, and this really compares complete the pairing of your process. You got to make sure your monitor is on, powered on, and ready to connect. Once your monitor is paired and you're ready to take a reading, just open the app, click the plus measurement button, and you take a reading the way you normally will. And your results automatically get synced to the app. There's no need to record anything. And with our manual and with our Bluetooth compatible monitor, it's really simple. This makes it easier than ever for patient to track trend over time. They could share results with healthcare provider. It allows them to stay engaged on their health journey. They could also share the results with family members as well. So for pharmacists and healthcare provider like you, this app could also become a really valuable tool to encourage patients to stay engaged. It's really supporting self-monitoring, and it helps the patient stay engaged in and ensure to long-term adherence to to their hypertension management and to their goal. So whether your patient is tech savvy or they're just starting out, the A&D HeartTrack makes it really easy for them to take control right from the phone. So it's a perfect partner to our Bluetooth devices. And this is just another way A&D Medical is helping Canadians live healthier, more empowered life. So in closing, just before we wrap up today's session, I'd just like to leave you with a short but impactful video from A&D Medical. And really what it is, it's a clear, patient-friendly guide that walks you step-by-step correct technique for measuring your blood pressure, and it's really very simple. And as pharmacists, a nurse, or healthcare professional, you play a key role in helping patients use their monitor correctly. So I really encourage you to share this video or simply highlight some of the key tips during this video during your consultation. So this really avoids common mistakes. It helps improve measurement accuracy, and ultimately what it does, it supports better healthcare outcome. So let's just take a look at this short video.
A&D blood pressure monitors allow you to keep an eye on your heart health at home. This monitor comes with an adjustable wide-range cuff, owner's manual, quick start guide, and includes a carrying case and 4 AA batteries for immediate use, as well as an optional power source and portability. The monitor provides reliable and trustworthy readings and has clinical-grade accuracy, so it delivers measurements that are as precise as those taken in a medical setting. To get the best readings, avoid eating, drinking alcohol, smoking, bathing, or exercising for at least 30 minutes before use. Make sure the cuff is about a ½ inch above your elbow and that you can fit 2 fingers between your arm and the cuff with the air hose pointing towards the middle of your palm. Keep your arm at heart level and sit down with your back supported and your feet flat on the ground. The device features 1-button operation for quick and easy functionality. Press the Start-Stop button and stay still and quiet during the measurement. While it's taking your reading, breathe normally and don't hold your breath, as that can cause a high reading. It's that easy. It's best to check your blood pressure at the same time each day. The A&D blood pressure monitor has color-coded bars on the display for quick understanding. Green for optimal or normal, yellow for normal high or hypertension type 1, and red for hypertension type 2 or 3. If the monitor detects an irregular heartbeat, the IHB symbol will blink. You can review readings on the device using the up or down arrow button, and it will display the average of all measurements. To ensure accurate readings, this monitor offers advanced cuff fit detection to avoid errors from incorrect cuff placement, and with integrated movement detection, it minimizes the risk of inaccurate results due to movement. With Bluetooth capabilities, you can use the highly rated HeartTrack app to track unlimited measurements and easily share your data with your friends, family, or doctor. A&D Medical, empowering health one beat at a time.
Okay, so I'm not sure if there's any questions, anything that we need to clarify. Is there any questions from the group?
Yes, there is a question from Kim. Are all your models both AC and battery?
Our One Touch, our entry level, it comes with batteries and it does not have a port for an AC adapter. However, all our other monitors either come with batteries, AC adapter, and they all have a port. So, for example, the 770 comes with batteries, but there's a port for AC adapter. The 1040 comes with batteries, and there's a port for AC adapter. The 810 AC adapter is included in it.
Okay, thank you. Does someone have any question? No, I think you can continue your presentation, Dean.
Well, actually, this really brings us to the end of today's session. So I really want to say thank you so much for joining us. And we truly appreciate the time and interest in A&D Medical and our commitment to delivering precision and care in every product. I mean, if you like to stay connected and be the first to hear about new product launch, educational contents, promotion, and even more, we invite you to follow us on social media. Just simply scan the QR code on your screen and follow us across your favorite platform. So again, thanks for being part of the A&E Medical community and for everything you do in supporting better health every day. Thank you, and we do appreciate your support.
Thank you very much, Dean and Pamela. It was really interesting, and I think everybody understands the need to have very efficient monitors to measure the blood pressure. Thank you so much.
Thank you.